Welcome to A Healthy Bite. You're one nibble closer to a more satisfying way of life, a healthier you, and bite-sized bits of healthy motivation. Now let's dig in on the dish with Rebecca Huff.
Hey, it's Rebecca, and today we are here with Dr. Laura Happy, and she has written a book that is going to be a really useful tool for parents. But before we get into talking about the book, tell us a little bit about yourself.
Okay, thanks. So I am a pharmacist by training. I've been a pharmacist for, 16 years now. But I actually don't work in a pharmacy. I'm a professor. So I teach the next generation of pharmacists. I teach at two different universities. I teach at Wingate University School of Pharmacy, which is here in Charlotte, North Carolina, where I live. And I also teach in an online program at the University of Florida. So I teach using the Zoom technology like we're using today.
Wow, that's pretty cool. I hadn't thought about that. I guess, so you do your classes live just via Zoom?
Correct. Yep.
Very interesting. I enjoyed looking at your book, and I showed it to my 11-year-old today, what is the age range that you would say is good for this book?
Rebecca, I'd say the age range is fluid because I think all kids are different. But generally, when I'm asked that question, I say middle school. I'm really curious to hear how your 11-year-old reacted. I've had parents as young as 9 reading it to their 9-year-olds that had really great conversations. So I generally say middle school, but it can really depend on what experiences your kids have had, what the community's like where you live, what they've heard about, that sort of thing. When I was writing the book, my oldest child was 12, and I did a little focus group with him and his friends just to kind of understand what they did and didn't know. And in our community, they knew about drugs. They had talked about drugs at school, but not really any specific type of drugs. So just the concept that there's this class of drugs called opioids was kind of new to them. But I'm sure there's 12-year-olds in other towns or in other situations that may know a lot more. My big message with the book is just to make sure that parents start talking.
Right. Well, that's, that is my daughter's reaction is, what is this about? She didn't know anything about this. And so I guess that kind of was my question is like, I'm always the avoidant type of parent. I'm like, okay, if we don't talk about it, it doesn't exist. But I know that's not true. And so she saw this book when it came, and she's like, oh, that's cute. And she liked the ox. And by the way, if you're not watching this on YouTube, if you're just listening on the podcast, the book is called If You Give an Ox an Oxy. And it kind of has the feel of if you give is it a cookie or the cupcake?
So there's actually several. It's the children's book series. The original was If You Give a Mouse a Cookie, but there's a moose a muffin, a pig a pancake. There's several in the series. So it's absolutely a parody of that children's book series. If you read that series to your kids or are reading it to them now, if you have young kids, if you kind of listen to the storyline, it actually follows the storyline of how a person maybe could become addicted to drugs because it's very cause and effect, right? So the moose asks for a muffin, then he needs some jelly, gets jelly on his face. So it's very cause and effect. And then, of course, at the end, the character always goes back to that original thing. So the mouse goes back to the cookie, the pig goes back to the pancake. So I wrote the story following that storyline. So the ox starts with a prescription medication called oxycodone, and then he starts misusing it and eventually becomes addicted, and then he gets better, and then he relapses. So it follows that same storyline, but then on every page, because this is targeted towards adolescents, I included information that explains these really kind of difficult concepts to that age group at a reading level and level of detail that they can understand and appreciate.
Yeah, it was very educational. As I was reading the story, first I just read kind of the story, like on the left-hand page. And then the second time I went through it with my daughter, I kind of went through with the definitions and the descriptions and things. I didn't get into the questions with her because she was like, oh, that's weird. I didn't know people did that. So this was a whole new topic for her, and it kind of opened it up, which I was kind of like relieved after we read it because, like I said, I always try to like avoid touchy subjects with my kids. I'm like, oh, if I tell them about it, then they're going to be curious. And oh, they're
Mhm.
going to want to like research it or something, but really it wasn't that bad. And so, yeah, it was interesting. I think it is a very good tool. I know that that's your goal in writing this. So for people that maybe don't know, which I'm sure with the crisis in America, most people do, but can you explain a little bit more about an oxy? What is an oxy?
Sure, sure. So oxy is just a slang term that is short for a prescription medication called oxycodone. It's been around since the mid 90s. And I really chose that particular prescription drug because it sounds good with ox, if you give an oxy. So there was the title. But the book is about all types of opioid medications. And so oxycodone is just one type of opioid medications, and there are several. And there's opioid, I'm using the term medications because I'm referring to those that are available by prescription within the medical system. So we have oxycodone, hydrocodone. Those are two of the very frequently used medications. Fentanyl is also in the medical system as an example. But then there is heroin, which is also an opioid medication, but I shouldn't use the word medication. It's an opioid substance, but it is illegal. So it's not a medication. It's what we refer to as a street drug, but it's similar to these medications that I just listed. So they're all kind of similar. They're actually derived from the opium poppy plant. That's where they originally came from, and that substance has really been used for much of history. It's a very good pain reliever. And so there's definitely a place for these medications. They're a very important part of pain treatment within the medical system. Unfortunately, the prescription medications have been diverted out of the prescription drug system and have been abused, and that's where we sort of have gotten into the problem that we have today.
Yes, it definitely is. Like you said, it's an epidemic. So what would you say is the average age that a young person is exposed to this risk? Because I read some of the statistics in your book and I was kind of surprised.
Yeah, so it's a great question. As I mentioned, opioids have a very important role to play in the medical system. And so they're really used to treat severe pain. So that's often from surgeries, or people that have cancer, for example, are in very severe pain. And that's where we see people using opioids. Certainly some children have cancer. Some children have, really bad, serious illnesses where they have to take opioids like this, unfortunately. And then some children have surgeries. I'd say surgeries are probably more common. That's more commonly where kids might be exposed to these. So common surgeries that teenagers or children would have would be like a tonsillectomy, getting your tonsils out, getting your appendix out. So it's perfectly natural and appropriate to prescribe an opioid following a big surgery like that. So again, not a lot of kids are going to be exposed to opioids, but if they're, have one of these medical conditions, they will be. And so the important thing is that when your child is treated in one of these scenarios, that you're just having that open conversation with both the doctor and with your child to just let them know that we want to use the medication just as the doctor prescribed, because if we start misusing it, then there's risks of taking these medications. And we want to ask our doctors to prescribe the lowest dose that they can and still control pain. And we always also want to ask them if there's a safer alternative, so for example, if you have a tooth pulled, for example, kids will have that happen sometimes. You might want to ask your doctor if you could take Tylenol if you don't actually need to have your child take an opioid for a situation like that. So really, just being aware and making your kids aware of those risks as appropriate for their age, and having that conversation with the doctors.
And you talked a little bit about misuse. Can you tell me how sometimes these opioid drugs are misused, even when they are prescriptions?
Yeah, that's a great question. So misuse is a very specific term. And when we say misuse, we mean that you're taking the medication in a way other than the way that it was prescribed. So maybe you're taking more, maybe you're taking it more frequently. So you're not taking it in that way that doctor originally told you to take it. It can also refer to taking someone else's prescription medication. So you should never take someone else's prescription medication. That's considered misuse. Also taking a medication to feel high. So opioid medications interact with the pleasure center in your brain. So they release dopamine, which is the chemical that is released when you laugh or when you get a hug or when you exercise. It's that feeling of happiness. And so some people will start to misuse opioids and take it to try to achieve that level of happiness as opposed to taking it for their pain relief. And then lastly, mixing a prescription pain medication with any other drug or alcohol is also considered misuse. So that's what misuse means. And misuse can lead downstream to abuse and even to addiction or substance use disorder. And the research shows that about 4% of 15-year-olds report that they have misused an opioid. So it's not a staggeringly high statistic. That's a good thing, but it's also a bad thing. We really want that to be zero, and of course, you don't want your child to be in that 4%. So
definitely, are the rates of people using these illegally, I guess you would say, are the rates going up or down?
Yeah, so the rates are actually going down for prescription medication abuse. And part of that is that the medical system has really kind of tightened the reins on access to these medications. So, for example, a lot of times for the first time a person gets an opioid prescription, they may only be able to get a 7-day supply because typically opioids are used for short-term pain. And so some of the laws in some of the states are such that you can only get a 7-day supply for that first fill. And so then if you need more, you may need to go back to your doctor and get another prescription. But for a lot of people who don't need more, that can kind of prevent extra pills laying around the house that then can end up being misused, for example. So as we've kind of seen a reduction in the misuse of prescription opioids, what we've actually seen is an increase in the use of street drugs like heroin. So that's kind of the second wave of the opioid epidemic. So as it was harder to misuse or abuse prescription opioids, more people turned to the street drug. It actually became cheaper and easier to access. And now we're kind of in a third wave of abuse in this crisis, and that is through illicit fentanyl. So I mentioned fentanyl earlier, which is a prescription medication. It's primarily used to treat severe pain like cancer pain. But you can make it. It's what we call a synthetic chemical. So you can mix things together and make it. And there's some street drug dealers, that have figured out how to produce it. And so they're producing it, and it's now in our street supply of drugs. The problem that's really, really scary about this street fentanyl is extremely potent. So it takes just a very, very little bit to relieve pain, and you can quickly take too much and end up in an overdose situation. And we're seeing, unfortunately, a lot of that on the news. And so with this illegal production of fentanyl, sometimes the doses are too high because there's a very small margin of error because it's so strong. So we're seeing a lot of overdose deaths because of this street-produced illicit fentanyl.
Wow. That is kind of a scary statistic. I knew that people did make, there's drugs people have. I guess how is it related to, say, like a meth thing? Is meth considered one of these types of drugs?
It's not. It's a great question. And as you point out, meth is something that a lot of people do make. Similar to fentanyl, although I think the raw supplies to make methamphetamine are even easier to get, really, than those that are used to make something like fentanyl. But methamphetamine is a stimulant.
Oh, I see.
So it's sort of a different class of medications, but it's a good point that you bring up.
Okay, so it's a completely different thing. I get it.
Yep.
So how can we help kids to understand better what opioid addiction actually is? Like just talking to our kids who've never even been exposed to it, like, because as I was talking to my daughter as we were looking through this book, and she's like, well, have I ever taken that medication, or will I have to? And so she was and I think it's almost better to talk to kids before they're exposed to it, because then they're like, oh, I know what that is. But so how do we talk to our kids, especially I feel like maybe our teenagers who maybe have been offered these drugs? How do we talk to them about how scary the risk is of becoming addicted, or even, like you said, overdosing and ending up in the hospital, or maybe even death?
Well, I mean, I sure wish there was a magic bullet and I knew exactly what a person should say to prevent, kids from experimenting with any type of drug, prescription or illicit or otherwise. But what I can say is, you mentioned earlier in our conversation that you tend to avoid the subject. And I understand that. And Rebecca, you're certainly not alone. So there's a survey of parents, and it asks a lot of questions about how and what they're talking to their kids about. And only 16% of respondents to this survey said that they were actually talking to their kids about prescription drug abuse. And that's way lower than the percentage of parents that are talking about smoking and alcohol. And frankly, I think that those topics are they're easier, right? So those are things that were around when you and I were younger, right? I mean, people weren't really abusing opioids when I was younger. And then I think the other complicating factor to do with opioids is that you have there is an appropriate medical treatment for them. And so they're not just a street drug. So it's different than something like methamphetamine. So I think it is more difficult to talk to your kids. And as I cited the research, with only 16%, people just may not know what to say, so,
Right.
so that's what I was trying to fill this gap here. And it may not be perfect, right? But I mean, it's a start, right? And I really just want people to start having that conversation with their kids, because I mean, the consequences can really just be deadly. When we circle back to that example that I gave on the street fentanyl, and most kids aren't buying their drugs on the street. The ones that report that they're misusing medications, they're actually getting it from friends or family is the most common way. And the second most common way is they're misusing things that have been prescribed by their doctors. But it's so scary to buy something on the street because of that really low margin of error on the chemicals, and how people can overdose so quickly.
Right. That is definitely scary. You have no idea what's in it or how it's been made. So, yeah. When someone is addicted to an opioid drug and they realize they are addicted, what are some of the steps that they can take? And also, what can doctors, I guess, or maybe rehab centers, what do they do to help break this addiction? How difficult is that?
Yeah, it's a great question. So, addiction, the medical community has really started to call that it's a disease, and they are using a different terminology for it. They're actually using substance use disorder. And the reason that they've kind of migrated to that is that there's some negative kind of baggage with that word addiction, right? So it's sometimes, people think that it's a moral failing, or that, you've made bad choices that have led you to this situation. But in fact, those things aren't true. I mean, it truly is, it is a disease, and the medical establishment, we treat it as such. So we use that term substance use disorder, and then we modify it based on what the substance is. So for example, opiate use disorder would be the technical term for what we would be talking about today. Alcohol use disorder would be another term. But in terms of treating opiate use disorder, so the real standard of care and what evidence-based therapy is, it's a combination of what we call medication-assisted therapy plus behavioral therapy. So the medication-assisted therapy, it's an agent that we use that helps reduce an individual's craving for the opioid, but also it prevents them from experiencing withdrawal symptoms. And so that's a big problem for people that are taking high doses of opioids. If they suddenly stop taking them, then they go into withdrawal, and the symptoms of withdrawal are just terrible. sweats, chills, fever, just feels like worse than the worst case of the flu. So by using this medication-assisted therapy, we can reduce those cravings but not throw somebody into withdrawal. But just like everything, it's best to incorporate lifestyle changes as well, and that's the behavioral treatment that kind of goes along with that. And that behavioral treatment can look different for different people. So it might be a 12-step program for some people. It might be changing their environment for different living situation, to kind of remove whatever those stimuli are for those persons. Cognitive behavioral therapy, where you're kind of retraining your brain on how to deal with certain circumstances. All of those are various potential components of behavioral therapy.
Mm-hmm. Two questions. So you talked about external stimuli, and I'm thinking so if, for example, someone who's been on drugs, maybe they've been doing opioid drugs since their teen years and they're maybe in their mid-20s, and where they grew up, their whole circle of friends, I'm sure I see you shaking your head, so I know you know where I'm going with this. Their whole circle of friends are doing these things. They kind of have this relationship, and then they go away to rehab and they recover, and then they come back home and they relapse, and then they go away to rehab and recover, and then come back. So how do you know, any good ways for people like this in this particular situation? Do they have to just move somewhere else forever? I know a couple of cases where one person keeps coming back to the hometown and they keep falling back into the same old patterns. And then another person who actually was able to successfully go through rehab and has been living drug-free for probably over a decade now. Why is it that some people, you could look at this from both sides of the coin. Why is it that some people end up addicted to opioids when they take them very quickly, and other people don't become addicted when they take them? You know what I'm saying? Sometimes more easily. I know the addiction, the disorder is possible for everyone, but why does it seem like sometimes it's easier for some people and harder for others? Is there a chemical makeup, or?
Well, the answer is yes. There are biological differences between different people that make certain people more susceptible to the disorder, for sure. And that's part of, I mentioned that it's a disease. So there's truly a biological underpinning to that. It's also a nature versus nurture thing. So there's factors that we know that are risk factors that will increase the likelihood that someone may become addicted. So there's genetic components or biologic components. And then there's also sort of the nurture things. What are those experiences in your life? So for example, in some of the research I cite in my book, it says, if you have parents who disapprove of drug use, then you're less likely to become addicted. If you have witnessed someone overdose, then you're more likely to become addicted. So some of these life experiences, also, big traumatic life experiences like childhood abuse or someone that's experienced a traumatic event, those traumatic events can add up to be risk factors. So really it's a combination of nature versus nurture, but we cannot perfectly predict if any one individual may or may not develop an issue. But I think that education around understanding what some of those risk factors are to help us to become more educated in who we're prescribing what, and allowing patients to kind of help make that decision. If you as a patient could understand that you have a high propensity for addiction, then, how you are treated and what decisions you make in terms of treatment may vary. They may not, but they may. So I think it's just all about sharing that knowledge and education so we can make better decisions.
That's good advice. So whenever they do use medications for breaking this cycle, how does the drug say, like naltrexone? Is it naltrexone? How do you pronounce it?
Naltrexone? Yep.
How does something like that work?
Okay, so there are receptors in your brain, and opioids will attach to those receptors in your brain. Okay. And so if they're attaching to them and they're causing that release of dopamine, we call that an agonist. So that is kind of, it makes it work. So, and that's an agonist. The opposite of that would be an antagonist, where it basically blocks that receptor in the brain. Okay. So naltrexone is an antagonist. And then you have sort of in the middle of the road here, one of the most commonly used medications for medication-assisted therapy is called buprenorphine. And that's a mixed agonist antagonist, or kind of a partial agonist, partial antagonist. So if you, that does the dual purpose of, it decreases those cravings, but it also doesn't throw you into withdrawal. The antagonist would really just throw you into withdrawal because it's stopping all of the functioning opioids. So someone who's been using opioids for a long time, they've got a lot of that agonist activity going on. And that's actually really how the overdose agent Narcan works as well. So it pulls all those opioids off of those receptors. And what happens with an opioid overdose is it slows down your breathing and you eventually stop breathing. And so naloxone pulls all of those agents off of those receptors, and then you can really start breathing just almost automatically.
Oh, wow.
So
That was kind of a technical thing.
a little bit of chemistry.
Yeah, I did realize that that somehow these drugs were able to block, the opioids from reaching the receptors, but it sounds like it just kind of unplugs the.
Yeah.
Yeah.
I always kind of think about them like a little puzzle, how they like fit together,
Right.
the drugs or the medicines and the receptors. And if you're trying to develop a new drug, you're trying to match, like, what is that receptor in the body and what's going to hook onto that and how strong it's going to be.
Wow. And typically, how long does it take for these things to work? I mean, when they go to rehab, I know it's like a combination of behavioral therapy and drugs, but what's the typical rehab time for someone who's has this disorder? I'm going to have to change my language because I've used addiction for so long, but I can see where it really can be a disorder, because I do think it's unfair that some people biologically are more prone to becoming addicted to these substances.
Yeah. I often compare it to another disease that we all know, type 2 diabetes. So type 2 diabetes has nature and nurture also, right? So people are genetically predisposed to develop type 2 diabetes, but there's also kind of lifestyle related things in terms of a lack of activity, or not eating the right foods, so I think people, if you can kind of wrap your head around that, then you can kind of see how substance use disorder is a disease and kind of fits in that same mold. So let's see, your question, was how long are the therapies? That's a tricky question. Generally, I think the easy way to answer it is the longer the better, so the longer that you can stay in rehab and the longer that you can stay on your MAT and your behavioral therapy, the better. The problem is that our insurance companies often just pay for a short-term stay at rehab. And so a lot of people can't stay as long as, potentially they need to, because the insurers just aren't covering the length of stay that we really need.
And that's why there's some of these nonprofit organizations out there that try to help people with these.
Yeah, absolutely. And they're expensive. Yeah.
Yes, I'm sure it is expensive to house and just all of the therapy. I mean, just going to therapy in general, even if you're only going an hour once a week, it's expensive. So,
Right.
Well, Dr. Happy, thank you so much for writing this book. It's again called If You Give an Ox an Oxy. And I was curious as I read it, do you have plans to write other books in the series?
Yes.
Maybe one about Mary and marijuana?
I like it. Yes. Well, that will be a tricky one. I was just in Denver last week, and in Colorado, marijuana is legal. So
Right.
I've got to think through that one. But yeah, definitely a great topic. I think the next one in my plan will be around vaping. There's just a lot on the news lately about vaping. Definitely a big problem. I saw in the news that cigarette smoking is the lowest it's ever been, which is a good news story, but we're just replacing it with vaping, right? In fact, vaping in teenagers is higher than cigarette smoking was at its peak.
Wow.
Yeah. So they definitely perceive that it's safer because more of them are using it, So that's the next one I'm going to tackle. Haven't quite decided on the animal yet, but I'll let you know.
I do think that you have a point there, because I think the more kids are doing more vaping because they do think that it's safer than smoking cigarettes, and which, they both cost money and they're both unnecessary. So I'm just like, save your money for something else. But I get it. It's hard. I know it's hard to be a teenager and go through all these things and peer pressure and everything. So I really appreciate you writing this book. And again, if you guys are watching, you can see this book. And if you're listening on the podcast, you might want to hop over to YouTube, but you can find all of the links to find Dr. Happy's website, and where you can get her book will be in the show notes on the website. So make sure you check that out. Again, thank you, Dr. Happy, for being here. I enjoyed talking to you very much.
Thanks, Rebecca. I appreciate it.
Thanks for listening. Please rate and review so other people can learn about this podcast. Find out more about sleep, hygiene, eating healthy, tasty recipes, zero-waste lifestyle, and lots more on ThatOrganicMom.com. Help us spread the word. Be blessed and stay healthy.